myself Dr. Ravina Kalyan, Faculty of Physiotherapy Department in RPIIT Technical and Medical Campus. Welcome to our YouTube channel RPIIT Academics. If you like the content of this channel, please do not forget to subscribe and share the content. So in the last presentation, we're talking about the elbow biomechanics. So in this, we'll talk about the kinetics and kinematics of the elbow joint. So first is elbow flexion and extension. So during elbow flexion and extension, joint involves are humero-ulnar joint and humero-radial joint, and the plane of motion is sagittal plane, and the axis of rotation is not fixed point. It is close to the line through the center of the trochlea and capitulum, not perpendicular to the longitudinal axis of the humerus, and palpation slightly distal to the connecting line between the lateral and medial epicondyle of the humerus. Next is osteokinematic movements. Range of motion of elbow flexion is about 0 to 145 degree. Somewhat hyperextension, especially in female. And functional range is mainly 30 to 130 degree. And close kinematic chain motions are pull up, push and pull. Next are the arthrokinematic movement. So first is concave on convex joint. It occurs during the distraction or compression of the ulna to the humerus. Anterior glide of the ulna on the humerus with elbow flexion, and posterior glide of the ulna on the humerus with elbow extension. So this figure represents the elbow flexion, that is the anterior glide of the ulna on the humerus, and in the posterior glide during elbow extension. Next are the factors checking elbow flexion. Soft tissue approximation at anterior humerus, coracoid process into coronoid fossa, radial head into radial fossa, passive tension of the triceps, tightness of the posterior joint muscle. Next is factor checking elbow extension, olecranon process into olecranon fossa, passive tension of the elbow flexors, passive tension of the collateral ligament, and the tightness of the anterior capsule. Thank you.